Welcome back to Your Eye on Health with Dr. Sudip Bose every Wednesday here on the front page. Doc, thanks so much for joining us today.
Well, we have two of us here joining us.
There's another guest here, a special guest we have here. No name for him yet, but we're working on it.
Well, you can submit if you can think of a name of our
Let us
third
know
co-host.
what you want us, exactly. Now, we're talking today about gallbladder disease, and really, what is it for our viewers who don't know what this is?
Very, very common, gallbladder disease. And the gallbladder is basically an organ that's tucked in the right upper part of your belly. So the right upper part.
Okay.
Here we have a Ziploc bag, which is our gallbladder today.
All right.
And it's kind of like a pouch. And in this bag, which is tucked up here in the right upper quadrant of the belly, there is bile. So bile is a liquid substance that helps us digest fat. So whenever we eat something fatty, big pizza, a burger, it squeezes and the bile comes out into your intestines and it helps break down that fat.
Got it.
So that's exactly what the gallbladder is doing.
Right.
But what happens is in that gallbladder, imagine you get little stones. So here you have a gallbladder and you have these little stones in there. And these stones are formed from many things, you know, largely made of cholesterol and other substances. And what happens is you can imagine if you have this pouch here,
right,
and you eat that burger and it goes down and all of a sudden your intestines has the burger in it, the gallbladder activates the squeeze, and then it's squeezing on the stones and it's very, very painful.
Yeah.
So what happens? You get pain in the right upper part of your belly, somewhere in the upper part right here. It can go to your back sometimes, and it's going to keep hurting until your gallbladder is basically taken out surgically.
Wow.
So what needs to be done, and surgically it's not as big of a deal these days. They don't even need to, you know, cut you open to take the gallbladder out. They make 3 mini holes, go in with the camera and pull out the gallbladder.
Wow, okay.
So if you are that unfortunate person who's been diagnosed with gallstone disease and you're waiting for your gallbladder to be taken out, maybe next month or something, until then, you have to eat salads, soups, things with no fat.
No fat at all.
Whenever you trigger this pouch to squeeze,
it's going to hurt.
It's going to hurt,
right?
And with the stones in there.
So you don't necessarily need the gallbladder. It can be removed and you don't need it? Is that what you're saying?
So what happens is your bile is made and the extra bile just kind of stores in that gallbladder. And then it's like a pouch for the extra bile that squeezes to allow that digestion of the fat. So when you take that pouch out, the bile is still going to be made. You're going to be able to digest the fat still, but
just not storing it.
Yeah, it's kind of in that way you can think of it like an appendix.
Right, you don't need it.
The appendix is totally useless, but the gallbladder has a function, but you can do it okay.
Right, but it can cause you major pain and major problems.
Right. So in general, you know, the groups that are susceptible to this are, yeah, anybody can get it, but mostly females, you know, maybe in their 40s. If you're pregnant, that triggers gallbladder disease.
Right.
So that's what causes the stones to form. And you know, if you're having pain in this area, that might be what it is.
Right, go to the doctor, go get checked out, because easy procedure, like you said, to get it removed. All right, doctor, thanks so much for joining us.
Thank you.
If you have any questions at home you want answered here on the front page on Wednesdays, go and submit them to the email there at the bottom of your screen. We'll be right back. Stay with us.